Today, we are taking a careful, science-based look at basil, a common culinary herb with a long medical history. I will walk you through what basil can realistically support in the human body, what the evidence actually says, and how to consume it safely and effectively. Botanical and historical background. Basil is botanically known as Ocimum basilicum and belongs to the mint family, Lamiaceae. Major varieties include sweet basil, Thai basil, lemon basil, and holy basil, also called Ocimum sanctum or tulsi. Sweet basil is most used in food, while holy basil is more studied for medicinal purposes. Historically, basil was used in Mediterranean cuisine, Ayurveda, and traditional African medicine for digestion, infections, and respiratory conditions. Its long use does not mean it cures disease, but it explains why modern research became interested in it. Bioactive compounds and chemistry. Unlike garlic, basil does not contain organosulfur compounds or allicin. Its health effects come mainly from phenolic and volatile compounds. Key compounds include eugenol, linalool, methylchavicol, rosmarinic acid, apigenin, and orientin. Eugenol contributes to anti-inflammatory and antimicrobial actions. Rosmarinic acid is a strong antioxidant and supports immune and respiratory health. Fresh basil retains more volatile oils than dried basil. Chopping or crushing basil helps release these oils, but prolonged heating reduces them. Light cooking is better than long boiling for preserving bioactivity. Aging or drying basil reduces aroma but keeps some polyphenols stable. Nutritional profile per 100 g raw basil. Raw basil is very low in calories and fat. It provides about 23 kilocalories per 100 grams. It contains small amounts of carbohydrates and about 3 grams of protein. Basil is rich in vitamin K, providing over 400% of daily needs per 100 grams. It also contains vitamin A, vitamin C, folate, calcium, magnesium, potassium, and iron. It provides antioxidant flavonoids such as lutein and beta-carotene. In real diets, basil is consumed in smaller amounts, but it still adds micronutrients and antioxidants. Evidence-based health effects. Cardiovascular health. Human studies suggest basil may support cardiovascular health but does not replace medication. Clinical trials on holy basil show modest reductions in total cholesterol, LDL cholesterol, and blood pressure. A randomized controlled trial published in Journal of Clinical Lipidology showed improved lipid profiles after 6 to 8 weeks of holy basil supplementation. Effects are supportive, not curative. Antimicrobial properties. Human data are limited but promising. Basil essential oil shows antibacterial and antifungal activity in clinical and food safety studies. Small human trials support its role in reducing oral bacteria and mild infections. It should not be used as a substitute for antibiotics. Anti-inflammatory and antioxidant effects. Human trials show reduced markers of oxidative stress and inflammation after basil or holy basil intake. Eugenol and rosmarinic acid inhibit inflammatory pathways similar to COX enzymes, but much weaker than drugs. This supports the claim that basil may help manage chronic low-grade inflammation. Potential anti-cancer properties. There is no strong clinical evidence that basil treats cancer. Epidemiological and mechanistic studies suggest its antioxidants may help protect cells from DNA damage. This is best described as cancer risk modulating, not cancer treating. Immune modulation and respiratory health. Randomized trials on holy basil show improved immune response and reduced frequency of upper respiratory symptoms. Participants reported fewer colds and faster recovery times. This supports traditional use, but effects remain moderate. Blood glucose regulation. Several human trials show mild reductions in fasting blood glucose and HbA1c in people with type 2 diabetes. Effects are modest and work best as part of a healthy diet and medical care. General body system support. Basil supports digestion, appetite regulation, and stress response. Its adaptogenic effects are mainly observed with holy basil extracts in human trials. Optimal consumption practices. Daily intake in studies ranges from 300 to 2000 milligrams of holy basil extract. For fresh basil, 5 to 15 grams per day is commonly used in traditional diets. Raw basil preserves volatile oils best. Light cooking is acceptable but prolonged heat reduces potency. Basil extracts provide standardized doses but vary in quality. Pairing basil with healthy fats like olive oil improves absorption of fat-soluble compounds. There is no allicin yield in basil, as it is not an organosulfur herb. Safety and contraindications. Basil is generally safe in food amounts. High intake or supplements may interact with blood-thinning drugs like warfarin due to high vitamin K. Possible side effects include mild stomach upset and strong body or breath odor. Avoid high-dose supplements before surgery or if you have bleeding disorders. Pregnant and breastfeeding women should avoid concentrated extracts. Supplement quality varies, and lack of standardization is a concern. Final takeaway. Basil is a nutrient-dense herb that may support heart health, immunity, blood sugar control, and inflammation management. It does not cure disease, but it can be a valuable part of a balanced diet. Use it wisely, consistently, and alongside medical advice. If you found this evidence-based breakdown helpful, please like this video, subscribe to the channel, follow for more nutrition science content, and share this with someone who loves healthy living. Your support helps this channel grow and keeps high-quality health education going.